Hi, I'm Dr. Eric Balcavage and welcome to the thyroid area of the website. If you've come to this area of the website, then you or a family member or friend is probably struggling with some form of thyroid problem or what you believe are hypothyroid symptoms. I've been helping people over the last 15 years in my practice recover from thyroid conditions and thyroid symptoms. It can be done and it can be done naturally. Matter of fact, the traditional model of how we take care of people in traditional medicine with hypothyroid conditions and hypothyroid symptoms is based on an old, outdated model. And that's why so many people are failing under traditional thyroid care. Thyroid problems are a growing issue in the United States, with Synthroid and levothyroxine being the most prescribed drugs over the last 3 to 5 years. So it is a growing problem. So if you struggle with thyroid symptoms and you're looking for help, you should probably call my office and see what we can do to help you naturally. How do you know if you should call, if this is the right place for you? Well, if you've been diagnosed with hyperthyroidism, also known as Graves', hypothyroidism, or Hashimoto's, the #1 cause of hypothyroidism in the United States, you should probably give the office a call. Some people are concerned that, well, I have a diagnosed condition, maybe I need medication, and you might. But what I do is different than what your primary care is doing or your endocrinologist. Their goal is to prescribe hormones. My job and what I do with functional medicine is help you understand why you developed the hypothyroid symptoms or the thyroid condition in the first place. If you have Graves' or Hashimoto's disease, those are autoimmune conditions. Those are not technically thyroid issues, they are actually immune system issues. Your immune system has decided to start attacking and destroying your thyroid gland. In many times you need thyroid hormone in those conditions, but we still need to address why the immune system is actually attacking the thyroid gland, because if we don't address that, then you are more likely to have more autoimmune conditions in the future. Who else should be considering coming for an appointment? Well, if you're taking thyroid hormone medication, maybe you've already been diagnosed as Hashimoto's, maybe you've already been diagnosed as hypothyroid, you're taking T4, a form like Synthroid or levothyroxine, and maybe your symptoms improved in the beginning, but now you still have the same symptoms, or your skin is still dry, or you're still struggling to lose weight. Your doctor's told you that your TSH and your T4 have normalized, so your thyroid gland is fine. It must be something else. If you're taking thyroid hormone medications and you still have hypothyroid symptoms, you need to call the office. There is a reason why your thyroid hormone levels are normal, your TSH levels are normal, but you still have symptoms. It's a condition called cellular hypothyroidism. What it means is that the thyroid hormone is stuck in the blood and it can't get into the peripheral cells of the body. Let's face it, you have hypothyroid symptoms not because the gland is not working, but because thyroid hormone can't get into your cells. That's what causes hypothyroid symptoms. What I do is help you identify why it's not getting into the cells and help you correct that, okay? Who else should call? If you have hypothyroid symptoms, but you've been told your labs are normal, and this happens all the time, especially when somebody first starts to have hypothyroid symptoms. Their skin starts to dry, their hair's starting to thin, they're tired, maybe they're gaining weight, and then you go to your primary care and you say, listen, I think I have all the symptoms I've read about hypothyroidism, I think I have that. And your doctor runs an incomplete lab test, usually just runs a TSH, maybe a T4, and they'll tell you that because your labs are normal, you can't have a thyroid problem. You must be stressed or depressed, and maybe they'll prescribe you a medication. Maybe they'll tell you you're probably just eating too much or you're not exercising enough. And if you just eat less and exercise more, your symptoms will go away. And for many people with cellular hypothyroidism, that is the worst advice that they can be given. And so if you're one of those people who has all the symptoms of hypothyroidism, but your TSH and your T4 levels are normal, call the office. I can explain to you why you have hypothyroid symptoms, and it's a fixable problem, okay? Who else? If you're tired of being tired and overweight and having dry skin and thinning hair, regardless of what the underlying issue is, if you're just tired of feeling lousy, call the office. There's a reason you feel that way. It's not just because you're stressed. It's not just because you don't exercise enough or you eat too much. There's a real metabolic problem here. And instead of waiting hours to get into, or days or months to get into an endocrinologist's office, or taking medications over and over again that just don't seem to work, it may be time to reach out to a functional medicine practitioner like myself and find out what you can do naturally to regain healthy thyroid physiology. So the last thing is, if you're looking to understand why your thyroid physiology is not working, not just be told, hey, it's not your gland's not working, take a medication, but to understand why the thyroid hormone's not getting into your cells, why the gland is not making enough T4 or T3, or why that gland's under attack, then you should call the office, because that is what we do in our office, is we help people understand what is the mechanisms, what are the causes that are driving thyroid glandular disease and cellular hypothyroid, a resistance to getting thyroid hormone in the cells that's causing your hypothyroid symptoms. So if you fit into one or all of these categories, call the office today and get scheduled for a thyroid consultation, and we'll review your case history, we'll review your lab tests, and give you some understanding as to what's wrong and how to go about fixing it. Okay? Hope to see you in the office soon.